Okay, so most people, whenever they're trying to figure out how to adjust, they take the skills that they learn in school and then they find the bits and pieces that actually work, and they add in what they've learned as an associate along the way. One of my associateships was using a Pro Adjuster, which is a computerized adjustment tool. So I thought, that piece would work very well. And so we use the ArthurStim here in the office, which is an awesome way to be safe, be effective, and also be really, really comfortable for the patient too, because we see a lot of post-stroke patients. So obviously we're not going to be using a lot of joint mobility in their neck because it's not safe. Another piece of the puzzle that we put together is I was in a practice that did a lot of soft tissue manipulation too. We called it NIMO. And when it comes to NIMO, you're just applying consistent pressure to a muscle, decreasing the tone overall, and then the muscle moves the joint, takes the pressure off the nerve, and the patient gets results. So we use a piece of that too. And then what I found is there's that good old joint movement and that big cavitation, that big ka-chunk, the crunching, because patients are real satisfied with that. Another piece of the puzzle that we added was using Thompson, so Thompson drop tables, because there's a really nice way of, it's actually easier for me to move hips, pelvis, sacrum, tailbone to get things aligned properly. So actually it's just less wear and tear on me as a practitioner, which means my longevity is going to be a lot higher than if I'm having to twist and drop on people all day long. We add up all those. We use a Thompson drop for the pelvis. We use diversified for the thoracics and the lumbar spine. And then we just flip people for a good old cervical adjustment, or we use our instruments for the rest of it. All in all, that's how we came up with the SAS method of really finding a great spot for most people. And at the end of the day, it's all about getting the right result.